welcome back. It's part 2 of my video where I answer all of your skincare questions. Questions that were left over from lives with a brilliant dermatologist called Dr. Emma Wedgeworth, but also questions that then popped up on all of these YouTube videos where I've just been saying, ask me anything, because in lockdown time, now's the time for me to get down and actually answer all of your questions. Now, on Sunday, I've got a video specifically about coping with sensitive skin issues and all of the new products, plus some existing products, that have been launched that are finally tackling sensitive skin and sensitized skin. They are different. Right, so let's start. Best anti-aging moisturiser for greasy skin. Well, it's very interesting, isn't it? Greasy or oily skin traditionally is thought not to need a moisturiser. However, the way that we tend to treat oily and greasy skin is we tend to strip it by using harsh acids or benzoyl peroxide or even retinols. And what that tends to do is then damage the barrier function if they're not used properly. And we end up with this situation, we end up with oily skin that's also dehydrated. So does oily skin need a moisturiser? Not technically, but it does need hydration. And the key to hydration is to use a humectant and a lightweight hydrator. And by that, obviously, I'm going to say things like serums containing hyaluronic acid, glycerin, polyglutamic acid, anything that basically binds water into the skin, because oily skin can still be dehydrated. Dehydrated skin lacks water. Dry skin tends to lack sebum, ceramides, all of those natural moisturising factors. The end result is a skin that lacks water, so you need to bind and lock water into your skin. You need hyaluronic acid, and then on top of that I would put on glycerin, and then I would put on a lightweight ceramide solution, lotion. Try to stick with lotions rather than heavier creams and avoid oils. For me, the ranges to use would be HADA, LABO, CUREL, La Roche-Posay, TOLERIANE, any of those lightweight, unfragranced, gentle serum lotions, which is the one, I mean, I love this. I just happen to have this to hand because it's going to go into Sunday's video for sensitive skin, and that is the CUREL Moisturising Facial Milk. Load that on top of classic multimolecular hyaluronic acid, something like HADA LABO lotion number 1, Deciem multimolecular hyaluronic acid 2. Perfect, absolutely perfect. You'll get all of the hydration and the water locking ingredients that you need in your skin without occluding your pores. Best way to keep dry skin young: moisturise, moisturise, moisturise. And by dry skin, I presume we then mean not greasy skin that's dehydrated, but skin that lacks the natural moisturising factors. So it's dry and tight. And you'll know if you've got this type of skin. One, the chances are you'll look kind of poreless. A lot of the women whose skin I most admire when I see them in real life have dry skin, and they're addicted to balms and oils because their skin constantly feels tight. It can be uncomfortable to live in dry skin, but it often looks really beautiful if you look after it. So best way to stop it looking dehydrated, you can always tell dehydration lines because they tend to go the opposite way to expression lines. So look at, these are expression lines. You know, you get the one you express. If you have them all of the time and they tend to be rather than directional but cross-hatched, that's a sign of dehydration. Something that I often see on my body as I get older. And it's more of a sort of cross-hatching of lines, and it feels tight. And what you're going to need is you're going to need the humectants that I mentioned in my previous question. So you're going to need hyaluronic acid and glycerin, but then you can go in with natural moisturising factors, because that's what dry skin really lacks. It lacks natural moisturising factors, and natural moisturising factors are the things that your skin produces to keep it watertight. Hyaluronic acid, glycerin, fatty acids, cholesterol, ceramides. Something like the ordinary NMF is perfect. It's basically a collection of everything that your skin naturally needs to keep it watertight. If you have a dry skin and you love the feeling of oils, go for it. Just remember the fact that your skin has to metabolize the oils on the surface of your skin to make all of those glycerols and fatty acids available to it. Whereas if you can get it in a skincare product, the chances are it's going to get into the skin much more quickly. Emma Wedgeworth was saying that research had been done on very young babies with dry skin conditions, and they were proving that if you apply an oil to a skin, it hydrates as quickly as a moisturiser does, a well-formulated moisturiser. However, in the long term, you get more recurrence of dry skin if you use an oil as opposed to a moisturiser. So personally, I prefer a moisturiser. I just like to give all the active ingredients that my skin needs as quickly as possible, rather than making it work as it would with an oil. Best advice for hormonal acne, and pretty much most acne is hormonal, unless it's caused by overuse of makeup and not cleansing your skin, or you can get an acne, for example, when you're wearing a sweatband, or you're wearing a hairband, or you're wearing glasses. So every so often I'll get a spot here and here, and that's simply the act of occluding your skin with something physical. But generally, most acne has an underlying hormonal cause, because it's the hormones that are causing your skin to produce too much sebum and then to occlude the pores, to block the pores. My advice would be simple. Start off, it's a stepped approach, so start off with the salicylic acid. You know I like Paula's Choice 2% BHA. I prefer the gel. A lot of people like the liquid. The liquid actually feels quite oily. It's not, it's a solvent. I actually like the lotion as well, so I like the gel on specific spots, the lotion all over. Personally, I'm not a fan of the liquid, but that's just a question of the way it feels on my skin. And then I would say the next step would be something like ACNECIDE. ACNECIDE is benzoyl peroxide that you can get over the counter. It's one of the few benzoyl peroxides you can get over at the counter in the UK. You can also try putting niacinamide on the skin. That's a B vitamin that basically helps to stabilise and normalise sebum production. And then what you need to do is a really nice, gentle hydrating, not a balm or an oil, a hydrating cleanser, something like CeraVe Hydrating Gel Cleanser, and then load up with lightweight serums rather than thick occlusive creams and oils. Because like I said in the first question, an anti-aging moisturiser for greasy skin, if you treat acne-prone skin quite harshly by overstripping it with cleansers and clay masks and acids and things like that, it can become dehydrated. So the minute that routine, and I do have a 3-step video to tackling spots, and I will link it below, that I created about a year ago for mums continually asking me what they should use on their teenagers who are getting breakouts. If you use that routine for 6 weeks and your skin isn't starting to clear, it's time to see a medical expert. And by that, I mean your GP will be your first port of call. And if not your GP, then moving on to a dermatologist, either online with something like Dermatica. You can ask for advice from a pharmacist, but the next step will be a prescription product, something like DUAC, which is a combination of benzoyl peroxide and salicylic acid. And it's that combination that's actually really clever in the skin. But beyond that, you're talking about probably topical and oral antibiotics, topical and oral retinoids, until you get to the point where you're taking an oral vitamin A retinoic acid. So it's a step by step approach, but there are things you can do. The secret is to nip it in the bud as soon as possible. The minute it starts to mark and scar the face, then you're in a territory where those scars are going to last longer than the spots in the long term. So don't suffer in silence, ask for help as soon as possible. But there are lots of things you can do, including just upping your hygiene game. So, you know, wiping down your phone, making sure you wash your pillows regularly, making sure you wash your hands regularly, you try not to touch your hands too much, all of those things that can transfer. I'm continually doing this. Luckily enough, I don't suffer from spots, but I'm continually doing this. And in these times where we're not supposed to be touching our face at all, and watching videos back, it makes me realise how much I touch my face. So it's hard to break those habits, it really is, but there are lots of things that you can do, I promise. Also, lighten up on your makeup. It's a hard thing to do when you're trying to basically hide the spots you've got, but my advice would be to try and go oil-free in your makeup, and even to try a mineral powder. Jo Jones and I were talking about this because Jo has in the past suffered from quite bad breakouts, and she was saying that her favourite concealer is actually the Bare Minerals one, which is a powder. Most people think a powder isn't going to conceal, but it actually conceals very well. Consider swapping over, if you can bear to mineral makeup, because it's oil free, obviously, because it's a powder. It's got an inbuilt SPF, but it's also got very large molecules of minerals that sit over the surface of the pores. They don't actually go into the pores. So avoid anything that's long lasting. Anything that's kind of, you know, designed to stay in place for 48 hours is going to be more difficult to take off at the end of the day. And remember to cleanse your skin with a cloth. I do think a cloth is super important. You know I love a microfiber cloth. However, flannels, muslin cloths, all of those things are important. They give you a sense of physical exfoliation, and I just think they're better at cleansing oilier skins. The next question, how to make my skin seem less dull? exfoliate, exfoliate, exfoliate. Dull skin is essentially a build-up of dead skin cells. I mean, it can be a lack of oxygenated blood to the skin, in which case go for a quick walk, go for a brisk walk and your skin will appear more glowy again. If it doesn't and you're waking up and your skin is continually dull and grey and a bit ashy looking, you need to exfoliate the dead skin cells away. My advice would be you can do it physically every time you cleanse by using a cloth, but I do think an overnight lactic acid is really important. Garden of Wisdom do one, INKEY do one, really reasonably priced. SUPERDRUG might still have one in their Me Plus range as well. Lactic acid is a lovely first acid for anybody, but also it's more important because it hydrates and calms as it exfoliates overnight. Trust me, your skin will thank you for a once or twice a week overnight acid. It will take away those dead, dull, light absorbing skin cells overnight. It really will. Your skin will thank you for it. How often should you mask? How about I tell you I never mask? It's very interesting, isn't it? Jo and I were discussing this the last time we got together. She absolutely loves masks, and I think it's because she's prone to breakouts. So she loves clay and mud-based masks that draw the excess sebum out of her skin. I've never really had that problem, not since I was a teenager, and I used to have this really one stubborn spot right in the middle of my nose. I guess I would go with the hydration end of the mask. So if I'm going to do live television, or I'm going to do filming, or if I'm flying or anything like that, I might well use those little under eye masks to temporarily hyperhydrate the skin. Simply the act of putting a mask on the skin that is loaded with humectants, normally things like hyaluronic acid, but the act of actually putting something on the skin means that the water goes into the skin and it cannot escape back out again. You literally stop transepidermal water loss from happening, and if you can do that for half an hour, your skin will instantly appear plumper. I remember many years ago when these eye masks first came out, testing them with a Visier machine. That's the machine that reads every imperfection in your skin, pigmentation, dehydration, pores, lines, everything. And I remember doing before Visier readings and after Visier readings with, I think we used an Elemis eye mask. It might have been the Estee Lauder one. It's not going to make any difference which brand you really use, to be perfectly frank, so save your money and buy a high street one. And the lines were staggeringly small. I mean, they went from here right the way into here. It's a temporary effect, but they do work. So great for flying, great for if you're dehydrated, great for if you're hungover, great if you're going out for a remember when we used to go out for big events? Great if you're going out, great if you just want to look good, great if you just want to pamper yourself. Don't feel like you have to mask. I'm of the opinion that if a product is good and it's on your skin, then why not leave it on permanently? The one proviso to that would be obviously those skin drawing sand and sky type masks that Jo absolutely loves. They're obviously left on temporarily, where they basically just vacuum the excess sebum out of your skin. Don't feel like you have to spend money on masks. Primer or good skincare? I'm always going to say good skincare. Do you know, I've been watching a lot of makeup tutorials since I've been in lockdown, and it amazes me the amount of people that spray stuff on their skin. I'm looking at you, Lorna Lux. And then they spray things on afterwards, and it's like, I never use face sprays ever, and I would never spray a setting spray on my skin. I just feel like my makeup stays in place. Maybe it's because my skin's getting drier as I'm getting older. It's interesting, isn't it, how I mean, I could spend all day looking at these beautiful young women making up their faces, but for me, unless you have an oily skin that is continually shedding its makeup, and you know, within 2 or 3 hours your makeup is off, you really don't need a primer. I don't really get the role of primers in skincare. I would rather layer on a hyaluronic acid, layer on a vitamin C, layer on a glycerin based serum, and go straight in with my makeup. My makeup will stay in place all day. The only place it comes off is around my nose, because I've got hay fever and I'm continually rubbing my nose. Super annoying. The times I have to edit out my videos, you would not believe. Yes, even I annoy myself. Is it possible for skin to change type through the seasons? Yes, it's possible. I mean, fundamentally, your skin type is controlled by the environment, by your genes, by your genetic inheritance, and by what you do to your skin. But generally, you know, when you're younger, your skin is slightly oilier, and then it tends to go through a sort of phase of being fairly well balanced. It can become oilier when you're pregnant. It can become drier when you're pregnant. It can become oilier or drier when you go through menopause. It tends to have an underlying hormonal cause. So the three big sort of roller coasters are puberty, pregnancy, menopause. That's the three things that tend to change the type of skin you have, and you'll tend to get breakouts, or you'll tend to get drier. But the other things that can affect it are illness, obviously, and seasonal weather. If you have this, I mean, in the UK we have the central heating on for 6 months of the year, that will make everybody's skin much more drier and dehydrated. Invest in a tiny little kit that you put by the side of your bed that you can just put water in, and then you can evaporate it out through the night. They're amazing. They shouldn't cost a lot of money. They can cost like 20 or 30 pounds off Amazon. Those humidifiers, you know, you can get big ones obviously, but those humidifiers are really important for skin. And I remember, what was I watching? I was watching something on television, and she had, in America you can buy them where you just literally, instead of getting a bottle of Pepsi Max, once the bottle's empty, you put water in it, turn it upside down, put it by the side of your bed, and it gently hydrates. It's better for your throat and your chest too, if, like me, you're prone to coughing through hay fever. Coughing quite a lot in public at the moment. I'm very allergic to tree pollen, and most people are kind of running away from me thinking I have coronavirus. I don't. I just have hay fever, and it tickles my chest. So yes, buy yourself a nice cheap humidifier, sleep in it, sleep with it by the side of the bed, and you'll notice, or if you work from home, put it by your desk. Put it by your desk when we eventually get back to work. You'll notice a big difference. I don't think skin necessarily gets any oilier. I guess in the summer it might get a little bit oilier, and that's just the action of the heat on the skin, probably making you sweat more rather than produce more sebum. But yes, skin can change. It's not that you radically need to change your skincare routine, just be more mindful. I mean, I use different products every single day if my skin's feeling slightly drier, if I've had a bath, or I've slept badly, or, you know, I've been out for a brisk walk and it's been a bit windier. I'll use slightly richer formulations and slightly lighter formulations. Don't go out and buy whole new stuff. You really don't need to change your skincare up that much. Your skin does not get used to skincare products. It really doesn't. That is such a myth. Once you've found the skincare that suits your skin and tackles your skin's needs, stick with it. Don't feel you ever need to change it around. Do you need to use all the products from one brand? Of course you don't. Absolutely not. The fact that when I did my skincare shelfie live with Amanda Lamb, I had like 20 different brands on my skincare shelf. That's such an old-fashioned idea, probably from the days of, you know, 3-step skincare where we all use the same products. Absolutely not. Pick and choose. Some brands do great hyaluronic acid, some do great creams, some do great cleansers, some do great bronzers, some do great self-tanners. You know, pick and choose what you want from the brands you want. And my simple rule is never put skincare on a credit card. Skincare, high street skincare is better than it's ever been, and there's no reason to go into debt to look after your skin. Cure for a crepey neck. Oh, I get that. I actually don't really, I mean, I've got quite a crepey chest. It's funny, isn't it, how I sleep on my side, so these lines take longer and longer to go. And I was supposed to be doing a treatment with Dr. Sophie Schotter, where she was going to do little micro injections of cell stimulants. It's a little bit like Profilo, but I don't think she was going to use Profilo. And then we're going to do some IPL and some skincare to tackle this. I promise you, when this is all over, I'm going to do this. I'm going to get really good close-ups of it before and after, because honestly, but that is a crepey chest rather than a crepey neck. I think it's called something like polycleuderm, and that is when the skin on the neck goes like sort of chicken skin, so it goes cross-hatched and red and crepey, and it's really hard to treat. When I was speaking to the really lovely Dr. Emma Wedgworth, she was saying, you know, that the way to treat it essentially is with really light laser and retinols, but you have to be really careful with the neck. The skin on the neck is so fine. I actually don't have a sensitive neck. When I use my retinol all the way down, it never really bothered me. Even my prescription strength retinol, it was less sensitive here than on my face. But you have to be careful and build up really, really slowly. But it's exactly the same thing on your neck as on your face. And the secret is to use everything from here right the way to here, including your SPF. If you've left it too late and you're my age and you do have sun damage, then I think the thing to do is wear an SPF every day. Wear a tinted one, because a tint will make it look better. It will get rid of that redness. If you use something like one of the Heliocare ones or one of the SkinCeutical ones with a gentle tint in it, a little bit of makeup down here can make a big difference. If it's truly crepey, then you can have sort of any of those lightweight, they're not fillers, they're called skin boosters. So basically it's hyaluronic acid that is gently sort of threaded like Profilo, down here, or Restylane Skin Booster, one of those in there, and then what it does is it gently plumps out the surface. It can have a tendency to go bumpy though. I remember having my chest treated years ago and you couldn't really see it, but if you turn to the light you can sort of see little bumps for ages, and that's because look, I've got no fat under there at all and no boobs essentially. So what happens is anything that goes on an area with no fat underneath, you can have a tendency, if it's not done really skillfully, to slightly bump under the skin. It's not an easy one to treat, it's really not, but good skincare and a good SPF will go a long way. If it's red, you can have IPL and you can have laser on it to treat the redness, but you're going to have to treat the crepiness with hydration, the sun damage with an SPF and a little bit of laser, and then the pigmentation or the redness with an IPL laser as well. Cure for crepey neck with skincare, you don't need a specific neck cream, you really don't. Just take all of your skincare down to here. This will make a big difference with hyaluronic acid, with glycerin, and with a light retinol, it really will. Oh, why does skincare pill when I use hyaluronic acid? Good question. I think two things make skincare pill. One is single molecular hyaluronic acid. The early formulations of hyaluronic acid were single molecular and they were super tight, and they tended to sit on the surface of skin and form a film that tightened. And what happens if you used anything over the top, often it would start to roll off. So that's one thing to look out for. Always use a multimolecular hyaluronic acid, something like HADA LABO, Deciem multimolecular, triple hyaluronic acid from Beauty Pie. If you're in doubt, EUCERIN do an amazing hyaluronic acid, the multimolecular. If you're in doubt, then go back to the manufacturer and ask how many different molecular weights of hyaluronic acid it has in it. It really needs 2 or 3, because you need one to sit on the surface, which is the tight one to sit in the top layers, and then one to go very slightly deeper. So basically, I mean, we're talking microns here, but essentially you want one that tightens on the surface, one that hydrates, and one that locks in water. And that shouldn't pill off. The other thing that causes pilling off is silicons. It's one of the reasons that I try to avoid silicons in skincare, specifically in retinols or vitamin C's or hyaluronic acids, because it has a tendency, it feels lovely and velvety on your skin, but you will notice if you use different silicons, so for example, in your primer, then in your serum, then in your foundation, there comes a point where you suddenly start doing this and then it literally starts to peel away. I can't remember what I was testing the other day, but I used something and halfway through I sort of did this and my face started falling off. And it was my makeup rolling off. And so be careful of silicons. They're not bad for the skin at all. They can be incredible. What you have to look for is dimethicone on your INKEY list, and try not to use more than one product with it, dimethicone in at a time. Otherwise they can roll off. Sometimes you don't know until you try a new product and then it rolls off. Why use serums? Good question. I mean, I wasn't raised with serums. I was raised with moisturisers. So you would cleanse and then you would tone and then you would use a moisturiser, and that was it. I like serums because they are lightweight. They sink in your skin really easily, and essentially your serum is where all your active ingredients should be. So your hyaluronic acid should be in a serum, your vitamin C should be in a serum, your niacinamide should be in a serum, your retinol should be in a serum. And that means that all skincare can use it, all skin types can use it, and then you just add a moisturiser in to do what it does on the tin, and that is to add moisture. So I don't like to spend a lot of money on a moisturiser. I like to spend all my money on my serums. Serums are essentially like a really long vitamin-rich juice first thing in the morning, and then what would a moisturiser be? A moisturiser would be something like a glass of milk on top. Products for post-acne scarring. I'm getting a lot of this at the moment, and I think there are 2 things that you can use. You can use tranexamic acid, which I've talked about a lot. Both SkinCeuticals and the INKEY list have it. It's a new ingredient that's on the market, and it has an effect on the formation of blood vessels within the skin and melanin within the skin. It has a sort of anti-inflammatory effect, and so it's the inflammation that causes the pigmentation problem. And then vitamin C, and you really need to use vitamin C at roughly 20%. And there are 2 really good budget products that I mentioned in my last video, both by the INKEY list. One is the INKEY list tranexamic acid in the morning, and the other is the INKEY list C50 nighttime blemish treatment, which is a combination of a high level vitamin C and salicylic acid. So that will also work on active breakouts as well. You can use the tranexamic morning and night, but I would use the C50 nighttime just at night because it's quite a thick sort of gunky stick on the spot product. Crepey eyes. Oh, can I just say the simple rule is, if you mention a skin problem that I have, and I still have it, there's nothing you can put on it. If there was something you could put on crepey eyes, I wouldn't have crepey eyes, and I do have crepey eyes. They run in my family. Crepey eyes is simply I mean, some people don't have them when they get older. Some people have those brilliant open Madonna type eyes, but if you have a tendency to have quite small almond eyes and you've got quite fine skin, which I have here, and you're very expressive, which I also am, you'll end up with crepey eye skin. And the truth of the matter is, surgery is the gold standard. An upper and lower blepharoplasty, where they just take a slither of skin out here and a slither of skin out here and stitch it back, will tighten the skin. I mean, it won't make the skin any thicker, but it will tighten it. But surgery isn't for everybody. So what are the options? You can have a fractura, which is a form of needles put into the skin that deliver radio frequency into the skin and energy that tightens the skin and boosts collagen production. There's a plasma treatment that you can have where you get an arc of energy that sort of burns like microscopic areas into the skin. And then there's also this waffle treatment that I had, which is where a little heated kind of waffle type thing is put on the skin. Again, the whole idea is to cause micro trauma to the skin, and then the skin tightens and produces new collagen. I know people that have had the plasma. I know people that have had the waffle treatment. I know people that have had Fraxel. Fraxel is probably the best, which is the equivalent of microneedling done in a laser. I haven't tried the Fractura and the Morpheus 8, which is the needles that go into the skin and produce radio frequency energy that tightens the skin. I would like to try them. There's a lot of downtime. And when I say a lot of downtime, imagine how delicate the eye area is. One, it will swell. Two, it will become scabby and look like you've been dragged across a playground. You know when you used to fall over in a playground when you were younger? You'd get those sort of, the skin on your hands would get all grazed. Eyes look incredibly grazed afterwards. And the truth of the matter is, how well is it going to work on somebody by the time they get to my age? You've got to boost your collagen a lot. You really have. So the jury's out. The jury's out. I do think surgery is a gold standard. You need a retinol product around your eye. The truth of the matter is, retinol can be hard to take around the eye, so do look at retinol eye treatments. And that's the only reason that you need an eye treatment, is because if you find that you can't use your retinol serum at probably 1% right up around your eyes, or if you're using a prescription retinoid like Tret, you obviously can't use it around your eyes, so you need to have a retinol eye product, and that's the only reason that you really need a separate eye product. I really love Paula's Choice Ceramide Enriched Eye because it's got peptides in it, and it's got niacinamide, and it's got vitamin C, and it's got retinol in, and it's a really nice formulation. It's super rich. Interestingly enough, crepey skin doesn't really tend to hydrate and plump up that easily. It tends to stay crepey no matter what, and the simple reason is because you're continually moving your eyes. A lot of people I know, when they get to my age and they get these lines down here, hate them so much that they tend to fill their faces. Not naming names, but I just don't like that filled face look. I mean, I've got a big enough face already, so I'm not going to put any more filler in my eyes. I have tried filler under here. It didn't work. If you've got crepey skin, it tends to sit in massive, great big sausages and look absolutely awful. So there are no easy cures for crepey eyes. I feel your pain. I'm genuinely tempted to have an upper and lower blepharoplasty, because I know, looking at my mum, that this is only going to get heavier and this is only going to get crepier. In fact, I inherited from my father more than my mother, sadly. So I would absolutely have surgery. No judgment on anybody. It's a relatively easy operation and probably has less downtime than all of those weird lasers and waffle machines and plasma pens that everybody's using. And by the time you've had 3 of those, you might as well pay for an upper and lower eye job. That's what I think. Cami Parser is this amazing doctor in America that I've been following in LA. He does the best eye jobs ever. If ever I go to LA and see him and interview him, I'll get on a plane one day, and maybe if I'm brave enough, I will obviously take you along for the ride and video it. Best foundation for skin. That's a really good question, and it is a skincare question, because I do think that your foundation should almost be treated like skincare. Personally, I use IT Cosmetics CC cream with an SPF 50 most of the time, although this is the new Tom Ford, and I'm going to check it out afterwards and see how it films, but it's horribly expensive. I think it's like £112. I was gifted it. I'm so lucky. And it does come up quite light. I feel like I look quite light in here. What I want from my SPF, from my foundation, is I want an SPF in it. Not as a primary SPF, but I do think you won't go wrong with your SPF in your foundation. I want it to be demi-matte, so I want it to hide redness around my nose, any pigmentation on my skin, but to have a sort of demi-matte finish. So this here is what I call demi-matte. So I've got a little bit of glow here, a little bit of glow here, but demi-matte through the center panel, and I want it to last. Now, the INKEY CC cream comes in 3 different finishes: a glow one, an illuminating glow one, the classic one, and then also one for oily skin. That one was too mattifying for me. But honestly, hand on heart, what foundation you choose is what suits your skin, and what doesn't occlude your skin. So personally, I like oil-free foundations unless you've got really dry skin. And I did use a mineral makeup for years. I used to love the Laura Mercier Mineral Powder foundation, which I think has an SPF 30 in it. And on days when I'm not filming and I'm just got to pop down the road, I mean, if I wear makeup, then I will revert to my Laura Mercier Mineral Powder. I like something quick, easy, that stays in place. But I think the only foundations I've got a problem with are the ones that are formulated to stay on your skin for 24 or 48 hours. Anything that's long lasting, please, 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 please make sure you cleanse your face at night. Otherwise it will cause problems. I'm convinced that a lot of the occlusion you see on skins around here, when somebody turns to the light, they've got lots of little bumps under the skin, not in the center panel, which is much more hormonal, but on the cheeks here and on the face side here. I'm convinced that's caused by long lasting foundation that isn't being cleansed off properly. There you go. That's the last of the questions. On Sunday, little bit of a sneak preview. Products that have been launched to help heal sensitized skin and red skin. Serums, interestingly enough. There are creams and cleansers here as well, but actually serums that have been launched to help calm and rebuild your barrier function if your skin is sensitive or sensitized, which it might well be both during lockdown. Any questions, ask me below, because I can always come back and keep answering them.